Hi, welcome to HealthTime03. Today we are going to talk about colic. If you have a baby brother or sister, you will know that babies can cry a lot. They cry when they're hungry, tired, hot, or uncomfortable in any way. Well, colic is when a baby cries for hours at a time for no apparent reason. This is the extreme of normal crying behavior. A baby with colic can cry for over 3 hours non-stop, and this can happen 3 or 4 times a week. Although a baby with colic may cry for extended periods, doctors do not believe that colic is caused by pain. A baby with colic may, however, look as though he is in pain. He will lift his head, raise his knees into his chest, and become very red. Babies may also have trouble sleeping and refuse to eat. Luckily, colic is not a serious physical condition. Babies with colic continue to grow and develop normally. The worst effect of colic is the stress and anxiety that it causes for parents. Parents who have babies suffering with colic usually find it very difficult to cope on their own and need help and support from their friends and families. Colic affects about 20% of babies and affects both boys and girls. It usually starts at around 2 to 4 weeks of age and can last for months. We do not know what causes colic. Some people believe that it is caused by an immature nervous system. In this case, the baby simply cannot control when he or she starts and stops crying. Others believe that babies suffering with colic are ultra-sensitive to their environment. This means that simple, ordinary changes in the environment, such as a change in temperature, will cause the baby to cry. Colic does not require medical treatment. However, parents may want to visit the doctor to make sure that there isn't really a serious problem. Before visiting your doctor, rule out common causes of crying. Make sure the baby isn't hungry, tired, or uncomfortable in any way. Also, observe your baby's patterns of crying. At what time of day does the baby cry? At what time does he or she eat and sleep? This information will help in your doctor's analysis. There is no medicine for treating colic. However, there are various things a parent can do to try to comfort the baby. Parents who bottle feed, for instance, may want to try a different formula. Mothers who breastfeed sometimes find that eliminating certain foods from their diet helps. These include beans, garlic, spicy foods, and certain vegetables. Sometimes the baby has a lot of gas and needs to be burped often. There are a variety of techniques for soothing babies. Carry the baby in a front sling. Take him or her out for a walk or for a drive in a car. Rub the baby's stomach or back. Or wrap the baby up in a warm blanket. There are a number of techniques for soothing babies, and no one measure will work for every child. Having a baby who cries all the time can be very stressful, and it is important that a parent or guardian takes care of themselves. Babies pick up on anxiety in their environments and become even more agitated if the guardian is stressed out. Sometimes a parent just needs to take a break. Ask a friend or a relative to watch the baby for a few hours so you can relax and take care of yourself. Okay, here's a recap of some of the things we spoke about today. Colic is when a baby cries non-stop for more than 3 hours a day, 3 to 4 days a week during the first 4 months of life. Colic is not a serious medical condition and is not usually caused by pain. Colic affects about 20% of babies and affects both boys and girls. Colic does not require medical treatment. However, guardians of babies who cry incessantly should consult a medical professional to ensure that there isn't a serious problem. Well, that's it for today. I'll see you again soon.